we've got some Q's and A's, which we're going to be addressing presently. If you have any of your own that you want to get off your chest, now's the time. Here's the place. It's a safe forum, and you know, no question too big or too small. I will do my level best to answer it, and if I don't know the answer, I can Google it live and direct here. So you know, we can't lose. So yeah, if you've got any questions, preferably plastic surgery related, then do furnish me with those. And if you haven't, sit back, relax, and we will be answering some questions that we have had previously. Thank goodness, because if I was waiting for you guys to ask me a question, I think I'd be waiting for quite some time. I say you guys. Yeah. Oh, look. Yeah, we have got Jackie. Come on. Always rely on Jackie. You guy. Are you waiting for you guy to ask me a question? Anyway, don't worry, Jackie. You don't have to ask a question because I've got one here. So panic not. Can we remove a corn on the toe? What is a corn? I don't know what a corn is. Is it like thickened skin? I'm going to say no. I think this is more like a podiatrist. This isn't really our realm. I think the fact that I didn't know what a corn was probably an indicator that I'm not the best person to come to for corn removal procedures. I might stand corrected, but I feel like it's kind of like thickened skin, and I would imagine it's removed by kind of shaving it down. And so not really our bag. We're more like sort of cutting things out. So this, I would say, is a podiatrist or a sort of foot doctor, I would suggest. So no, just going to go no on that one and move on. How long do I need off work after having a tummy tuck? Right, then big op a tummy tuck, don't underestimate it, and it does depend on what you do. My shirt's white, so I can't see. I've got white on white. It does depend on what you do for a living. So let's just take it from the top. So the first week you're going to have dressings on and all sorts. You're going to be bent over, so you're not going to want to be doing anything. You're going to be at home. You will be pottering around the house. So you won't be like bed bound. You will be pottering around the house, but you'll be pottering around the house in a bent over position. And it will be uncomfortable, and you will feel sore and swollen and what have you. So then you'll come back at a week. We take all the dressings off at a week, and then you don't have any dressings on, but you'll still be bent over. And you will be able to sit at home and do some work on the computer at the second week. So if you can work from home, doing some computer work, you might not want to be doing a full day, but you will be able to do something on the computer in the second week. After 2 weeks, you might be able to drive and things like that. So often work is reliant on driving. So 2 weeks, you can sort of start to get back into things like drive. I mean, this depends on how well it heals. Sometimes it takes longer to heal. Sometimes it doesn't take so long. So this is sort of broadly speaking, obviously. So I'm going to say 2 weeks, you'll be able to start driving. You'll be able to start doing things at the gym with your lower body. You'll be able to do the stepper and the bike and things like that. But in terms of getting back into full days at work, so whilst you can drive, I don't think you want to be driving going to a 9 to 5 job, Monday to Friday. So, phased return, light duties, that sort of thing. And then probably 3 or 4 weeks before you start getting into a bit more of normal work regimes. If your work requires any heavy lifting, or if you want to know about the gym, a lot of people want to sort of get back to the gym, because often when they've having a tummy tuck, they try and get their body into shape and go to the gym a lot, and then you have the tummy tuck and you've got to stop, which can be difficult for patients. So I understand that they often want to get back to the gym. So that would be normally around I say 4 to 6 weeks. 6 weeks is safer. 4 weeks you can sort of start gently getting back into it. 6 weeks is kind of safer, but you're not going to be full strength at 6 weeks. You're going to be, because obviously you haven't been in the gym for a few weeks, and also you're going to be a bit uncomfortable still and a bit sore, and the scar's still going to be quite red. And so yeah, and it's similar for work. If you're lifting stuff, it's 6 weeks if you're putting power through your core and lifting people or boxes or something. And even then, as I say, you're going to be a bit uncomfortable, so you're not going to be like as good as you were before. It takes a couple of months to sort of build up. Oh, you wait. What is this? Are you a doctor? Yeah, I'm a doctor. Yeah, I am a doctor. So I am a doctor, doctor of medicine, plastic surgeon. It's a plastic surgery Q&A is what this is. I think you can probably tell by the activity in the chat, of which there's not so much at the moment, but yeah, it's a question and answer session on plastic surgery stuff, and I do it every Tuesday at 7 o'clock. I've been doing it for years, but I've only recently started doing it on TikTok. So TikTok's my late, and I've got a white shirt, so I can't see. Oh, still. Oh. So yeah. So what happens is people ask questions in the week, and I say, look, put it on the Q&A, and then on a Tuesday at 7 o'clock, I answer the questions. But if you've got any questions live, you can answer them about plastic surgery stuff. Like this one, for instance, just to give you an example, what sort of questions we're talking about. Do we offer buccal fat removal? That sort of question. So I've got a clinic in Edgbaston in Birmingham. So that's what they're alluding to. But we don't do facial plastic surgery. So we do breast and body contouring, and we're really focusing now on minor procedures, moles, cysts, lumps, bumps, tattoo removal, split earlobe, areola reduction, inverted dimple correction, local anesthetic procedures is what we're kind of focusing on now. But we do offer breast augmentation, breast lifts, breast reductions, tummy tucks, so yeah, so that's the main thrust of the specialty. So buccal fat removal, that would be a facial plastic surgeon, of which I'm not. I'm a breast and body contouring surgeon. And so buccal fat removal. So what do you think about that? So buccal fat, is that the dimple? Are you talking about dimple creation? I mean, we don't offer it anyway, so I don't know. I don't know if we should not explore the question, but since we're here, let's explore the question. Buccal fat. So it's kind of, buccal is cheek. So the cheek fat. I'm not sure if that's dimple creation, which I know is a thing. Often facial cosmetic surgery, it used to be more about kind of fat removal. You know, you look at the sort of eye bags and removing of fat and things. And more recently, I think it's phasing more into sort of fat restoration and actually adding fat to the face. Because what you look at, if you look at a sort of child, and let's be honest with ourselves, that's what we're trying to look like. We're trying to look like children in terms of facial rejuvenation, or it's not face, it's whole body rejuvenation. Maybe children sounds a bit creepy, you know, young adults, should we say, if you don't want to, you know, I hope you know what I mean when I say, you know, young, we want to look like young people, basically. And young people have more fat in their face, and as you age, that fat atrophies, the skin loses elasticity, sort of eyes become sunken, and your face you lose that sort of fat, the cheeks, you know, the cheek fat. So a lot of facial cosmetic surgery is involved in actually restoring fat, as opposed to what it used to be, which was removing fat. But I don't do it. So I think so. Can I just see if there's? Oh, there we go. Oh, we've got a question there. You don't do age spots, do you? So sorry, because I've got a white shirt, I can't read the white. Oh, I could do that, couldn't I? You don't do age spots, do you? What do you mean by age spots? So age spots. So we do moles. So we will remove moles, and so yes, we would remove moles. So it depends on what you mean by age spots. So people call them moles, beauty spots, freckles. You know, so we can kind of remove most things. The thing to do, Liz, is send us a photo. And WhatsApp is really, I'm doing this because I can't read the white writing. And WhatsApp is really good. WhatsApp's been really helpful because you can send us a photo on WhatsApp and say, do you remove this thing, rather than kind of go age spots, because it depends what you mean by age spots. But most of the stuff we do is kind of surgical. So if they're kind of small and if they're multiple, then there might be some non-surgical treatment for it. So age spots might lend itself to a more of a sort of pigmented areas of your face, which might be more of a dermatologist. But it's certainly, if they're kind of moles, that's something that we would do. So yeah, send us a photo, Liz, and that would be flat brown patches. There you go. I mean, the answer is yes. We do remove flat brown patches, but we do them. Okay, but we do them by cutting them out, Liz. So if they're flat, and if it's kind of just mild, then there might be some other treatment, some non-surgical treatment that might be more appropriate. So probably, as I say, by all means, send us a photo, but it might be worth looking for perhaps some non-surgical treatment, maybe from a dermatologist. The one I usually recommend is Michelle Thompson, who works at the Priory, who I used to work with when I was in the NHS, which is also in Edgbaston. It's a hospital down the road from my clinic. She's got the Birmingham Skin Clinic, so she might be able to help. If they can't help, then by all means, you know, we might be able to help. And as I say, send us a photo, and we might be a bit more accurate about it. If you sort of go on the website, there should be a button saying send us a photo, or no, chat with us on WhatsApp, I think that says. But you can send us a photo on WhatsApp, or you can email it, or whatever. Or maybe you can send it on TikTok. Can you send us photos on TikTok? Maybe you can. If you can, do it like that. Invite another. Right. Okay. Right. What we got? I'll tell you what we got. We got this one. Would I need to book in for a consultation for you to review some moles and whether they need to be removed? Well, Liz, same thing, isn't it? I mean, this is what I'm trying to propagate. We've got Zakia has started today, who's our videographer, and I've got high hopes. Well, I've always had high hopes about video. I've done that, as I say, I've done this for years, and this kind of video thing, but I really want to do more videos around the clinic, and I really want to get some of the messages across of one of the sort of the things that I do in my practice, in my business. And one of the things I'm trying to do is to simplify the process of having a lesion removed, whether that lesion be a mole or a cyst or a lipoma or a tattoo, or any sort of minor op. Really, is also split earlobes and all the other things that we do. And the way I've done that is by we used to have sort of a contact us thing. Now the WhatsApp button seems to be really good, and I'm thinking of actually redeveloping the website to get the WhatsApp button more kind of prominent, as being a prominent call to action on the website, because people really like to engage on WhatsApp. And because we've got business WhatsApp, we can have it on several computers, so we can all monitor it. And so what I've tried to do, in order to streamline it, I say to people, look, you can send us a photo of your mole / moles, and we can first of all say whether we can remove it, like Liz with your age spots. Then we can say, look, yes, we can remove it, or perhaps you should try this other sort of treatment. And then we can also say, this is how much it would cost to remove it, or them. And then you can say, well, that sounds good. I would like to have that done, please. And then what you can do is book in for what we call our see and treat clinic, which means that we see people on the same day we do the surgery, remove the lesion. So that is something that's really working well. I saw someone today who's got a mole, who's seen had the photo sent off. They said, yeah, it's suspicious. They think it might be a cancer, but they're going to have to wait a few weeks to see someone in the NHS, and they were worried about it. So they called us up. I saw them today. They probably called a couple of days ago, and a couple of days ago would be Sunday, wouldn't it? Oh, might have called on Sunday. Not on Sunday. Okay, I don't know when they called, but they didn't call that long ago anyway. The point is, and they came, they saw me this morning, and I removed the mole there and then. Mole's off, and then you can sort of relax a bit. So yeah, so we're trying to streamline. So the point is, you don't need to come for a consultation. We look at the mole, we tell you how much it's going to cost. You say you want to have it removed, you book in, in 3-4 weeks time and then have it removed in 3-4 weeks time. It means you come in twice, and it means there's that delay period of you, because often when people come, they know they want the thing removed. So it's not a question of diagnosis. They often know. And as I say, if you send us a photo, we can often say, look, that looks like it should be removed, or it looks fine, but if you want it removed, we can remove it. So often there's not that sort of element of diagnosis that you get with other sort of consultations where you need to see the doctor first before they're going to book you in for surgery. There's not many areas of surgery where you would actually just book someone straight into surgery without actually having a consultation, but this is one of them. For bigger ops, we do the breast augmentations, tummy tucks, breast lifts. Obviously, they're not suitable. We have to see you in the clinic. You have a think. We often see you again. We can see you 2, 3, 4 times, and then we book you in for surgery. But for things like this, the moles, the cysts, the lumps, the bumps, the lipomas, people often know they want to have it removed, and they don't really want to come twice. They don't really want to come for 2 consultations. So we cut out the first consultation by getting you to send us a photo on WhatsApp. I say you can email it or whatever, or on whatever these social media things, whatever, but send us a photo somehow, and then we will give you a price, and then you can decide whether you want to have it done. And if you do want to have it done, you come straight, have it done the same day as consultation. By the way, if you have a consultation and you don't fancy it, you think, hold on a minute, I don't fancy it, then you don't have to have it done. You can just go home, and you get your deposit back, and we don't no hard feelings. You might have to think, you might have time to think about it, because we might say something to you or show you a photo of a scar that you don't like the look of or something. So there's no pressure on that side of things, but I think it is a good thing. And I can see, sorry, I have to do this to read the thing on TikTok. Yeah, someone said See and Treat is superb, so that is what we want. I don't know if they're on the payroll, but whether they are or not. All right, okay, thanks. That's Liz. Black brown patches. I'm sure someone said that. Here we go. Oh, it's Liz. See and Treat. Yeah, thanks, Liz. Nice one. So yeah, so you don't. So the answer is no. You don't have to come for a consultation to review your moles. You can send us a photo, and we will review your moles and give you an opinion on what we think about them, and also whether you should be thinking about urgently removing them or not, and what sort of price it will cost to remove them, and then you can move from there. See and treat. Yeah. Focus on that now. Do we offer labiaplasty? No. So that's another area. So buccal fat removal, more like facial plastic surgeons. So labiaplasty. I mean, actually, quite a lot of plastic surgeons do labiaplasty, to be fair. But I don't. It's never really something I've got into. I could have done, really, because I did quite a lot of vulval reconstruction for cancers in my training. I wrote a paper about vulval reconstruction when I was at the Marsden. So I have done a lot of surgery around that area, but it's not really anything that I've kind of got into on a cosmetic level, and in my private practice it's never really something I've embraced. So no, I don't offer labiaplasty, but yeah, as I say, it's quite a common thing for plastic surgeons to offer, but just not this one. So do you have any surgeons that specialize in breast implant bottoming issues? It's an interesting one, this. I remember when I was doing my big reconstructions in the NHS, and every now and then you get a problem, and you sort of you have these colleagues who you respect, who are very good surgeons, and you would often go to those for advice, and you don't really want someone who has got loads of experience kind of with that complication. I mean, because there's a kind of fine line between someone who's good, so therefore has a wide experience, versus someone who's got a large experience of managing complications, because you've got to think, are they got a lot of complications because they're not very good, so it's a fine line. So you want someone with a lot of experience, and I've done a lot of breast implants, but I'll be honest with you, I haven't got a huge experience of breast implant bottoming issues or bottoming out, because it's not really a problem that I see very often. So it's a weird one, that. It's like, I don't know, if you find a surgeon who's got a huge experience of bottoming out, I guess they'll say, well, they're not my cases, they're other people's cases. So you might find that. but I'm not a surgeon who's got a huge experience, or at least specializes in breast implant bottoming out issues. What I will say is that breast implant bottoming out is a difficult problem. So basically, when an implant is placed, we always obviously try to make it placed perfectly, but it can be placed too high or too low. So if it's too high, and that's often when it's under the muscle kind of holds it up, you have to lower it. And to be fair, I have got quite a lot of experience of that. To be honest with you, probably I normally say to patients probably about once a year, I have to lower a set of implants. I haven't been doing that many implants recently, but certainly historically, I would say about once a year, I have to lower a set of implants because they're too high. And that's usually when they're under the muscle, and you just have to do what's called an inferior capsulotomy. So you release the lower part of the capsule. You often have to release some of the muscle because the muscle's kind of holding it up here. Probably haven't divided it quite enough, and then let the implant come down. So that's an implant sitting too high. And as I say, I have got experience of that. The other problem you can get is an implant sitting too low. So it actually descends below the inframammary fold. The inframammary fold is the fold where the bra sits. And so if the inframammary goes down there, then that's sort of bottoming out, and that can be an issue, and it is more difficult. It's quite a difficult problem to create when there's kind of too much breast in the lower pole. Kind of weirdly, when the implant's sitting high, often patients, the look in clothes is okay. It's just when you take your clothes off, it looks wrong because the nipple can look like it's sitting a bit too low. So cosmetically, actually, in clothes, it's not too bad. But bottoming out is kind of too much of the breast and the implant in the lower part of the breast, and it can be a difficult problem to create, to correct. You have to try and recreate the inframammary fold, which can be difficult. It's a lot easier to lower the inframammary fold than it is to raise it, because lowering it just means a bit of southward direction, dissection, and letting it sit at a lower place. But once it's been made too low and you have to try and higher it or raise it, you have to use quite a few either long-term dissolving or permanent sutures. Sometimes people use prosthetic meshes for this. It's in a situation where polyurethane implants are really good because they tend not to move. So once you've got them in the right place, they tend to stay in the same place. So there are measures that are being done, but it's quite a difficult problem to correct. And I'd be honest, full disclosure, I wouldn't say I specialize in breast implant bottoming issues. I'm not a specialist in it, simply because I see it extremely rarely. I've had it in very, very few patients, 1 or 2 patients in my career. So it's certainly not something that I would put myself out as an expert in. So if you're looking for someone who has a special interest in that, it's not me. But I don't know if anyone is really. I don't know if anyone would admit to being that, to be honest, because that means either they're getting a lot of referrals from other people, or they're getting problems with the implants they're putting in, I suppose. But I don't know, maybe you don't see it that way. Anyway, that's where I am. Sorry, I'm just looking for... Hi there, can you say happy birthday to my friend Mike? Right, okay, who is that? Is that who I think it is? Right. Okay, I'm not going to read out those comments live. I need someone vetting these comments. Who is that? Right, okay. Anyway, right. So, okay, thanks for that. I am, without further ado, I am going to wrap it up because it's been very active. Thanks for the comments. All comments are gratefully received, and I will, without further ado, go in there and sit on the sofa. So I'll suggest you do likewise. Thank you for your participation. Like one, yeah, thank you. What do you do plastic surgery wise? Face stuff or just body? Just body. Yeah, I don't do face stuff. Sorry, I'm not trying. Does it look like I'm trying to cover my face? I'm actually trying to read the comments if I put them up there. So yeah, I just do body, breast and body. My main, when I was in the NHS, it was breast reconstruction, so that's my special interest. So if you're new to the, if you want to know about how to choose a plastic surgeon, yeah, read it and weep, my friend. Okay, written by you. Yeah, that's me, by the way. I wrote the book on how to choose a plastic surgeon for your cosmetic breast surgery. So yeah, cosmetic breast surgery is my kind of special interest. And I started doing breast reconstruction in the NHS, and then went into cosmetic breast surgery and body contouring, tummy tucks, and liposuction and things like that. And now I pretty much only did that. So I never did facial plastic surgery. I don't do rhinoplasty. I don't do facelifts. I don't do brow lifts and what have you. We've got a couple of other surgeons at the clinic who do blepharoplasty, the eyelid surgery, and ear correction, prominent ear correction. I don't do those sorts of things anymore. Yeah, breast and body was my kind of special interest, my specialty. All plastic surgeons have got a specialty, and that's mine. It's backwards. Yeah, I saw that. It's backwards, isn't it? Yeah, I saw it look backwards on mine. I kind of hoped it wouldn't be backwards on yours. Why is it backwards? I mean, if you look at it on, oh yeah, it's backwards on there as well. Yeah. Anyway, it says never accept a lift from strangers, Jonathan J. Staiano, but it's backwards, isn't it? To get a mirror. Yeah, it's not. It's not gonna work, is it? There, can you read? No. Yeah. Anyway, actually, I can use the book to read the. Oh no, I can't because it's white. Yeah, I can use that bit. Thank you. I like the content. Oh blimey, keep it up. Flipping heck, I've got a positive. You can't turn it upside down. No, I realised that. Yeah, that doesn't work, does it? No. Okay, I'll have to rethink. Anyway, there you go. Yeah, so breast and body is what I do. So, good. So that's been eventful. Thank you, Liz. Oh, no, not Liz. Trojan Escapes. Sorry. Thank you, Trojan, for that. And also Liz for the input. And I will, I think it's about time that I get out of here before anything else happens, like trying to turn the book upside down because it's a mirror image. And I will be back next week, by the way, if you're around. So next Tuesday, 7 o'clock. Yeah, I do this every week. Would you believe? That's why I'm such a seamless professional. You know, it doesn't just come overnight. This sort of presentation. You know, it's years behind it. So yeah, I will be back. What does that say? Have a good evening, and you, Trojan, have a good evening yourself. And I will